Acne vulgaris. Are you interested in getting facts or all pieces of information as per acne vulgaris? If that is your goal, you're in the right place. Without further ado, let's go. Hi, I want to make this presentation on acne vulgaris. This is a problem affecting teenagers as soon as they reach puberty. Acne is a problem commonly found in teenagers and is associated with puberty. It improves with age because the situation is going to improve after year 18. May, however, remain after the year of 20 and in some people till the age of 30 and beyond. If you have permanent scarring, don't become depressed because there is possibility of anxiety, depression, and suicidal ideation. It is possible that acne could be inflammatory and might be non-inflammatory. Epidemiologically, it is worldwide and is found in all ethnic groups. However, there's more in Western world. Teenagers more affected. It could be found in some adults also, but a small proportion of adults will be affected. If both blacks and whites are affected the same way, it is more severe in whites than blacks. The culprits here are androgens, because androgens lead to increased oil sebum production, dihydrotestosterone and dihydrotestosterone have been identified here. Keratinization will lead to forming of comedrol, and the bacteria will invade the follicles. That will lead to inflammation and oxidation. Microcomedones are formed because dead skin cells are trapped by the oily sebum. The location of the microcomedone determines whether it is white or black. If it is not exposed to the atmosphere, it will be called whitehead because there will be no oxidation occurring there. On the contrary, if it is superficially located and oxidation occurs at the periphery there, then it will become black and be called blackhead acne or comedone. Acne and teenage years. Yes. Why at teenage years? The androgens, dihydroepiandrosterone, are produced in teenagers during adrenal. That is the stage where they develop pubic and axillary hair. At that time, they also develop body odor and acne will set in. So it could be in form of papules, pustules, or nodules. It will be nodules when it is deep down, and that could be very serious. What are the possible triggers of acne in teenagers? Medications. Somebody is on lithium iodide for whatever reason, phenytoin bromides for abortion, steroids, androgens, topical agents, oily cosmetics, tars, and ointments. Mechanical pressure or occlusion, e.g., tight cap, tight hat, tight face mask, or tight scarf around the cervix could worsen acne in teenagers. Emotional stress. Some should watch it. When do they get it worst? Yeah, when they are stressed out, traveling, preparing for exam, under one pressure or the other, sleepless nights, then the acne will come out, more pronounced than when they are resting more. Don't worry about some stuff that you've had before, that chocolate, greasy foods, and so on and so forth. No, chocolate will not worsen acne for you. Greasy foods will not. Blackheads are not because you're dirty, but because it's oxidized. The more you wash your face, the more likelihood of acne. It is not because of poor hygiene, it's actually the other way around. Acne types could be comedonal, and that could be sparse and no scaring. Could be comedonal that will be popular, moderate, and little scary. Could be comedonal that will be popular, pustular, and scary. And it could be nodulocystic acne, and the risk of scarring is very severe here. Appears at the upper chest and the back. Differential diagnosis of acne could be keratosis pilaris, rosacea, perioral dermatitis, and folliculitis. How do we make diagnosis of acne vulgaris? Mainly clinical. Appearance with history is enough. So we take history and we do physical examination, and that's it. It's located on the face, the chest, and the back, and we are likely going to assess the level of severity. If it is whitehead, like I've said just a while ago, it will be a kind of dead skin cells inside, and inflammation is at the periphery. The blackhead, on the other hand, the dead skin is at the superficial level and oxidation is taking place there. That's why it is black. It could be with pustule, in which case there will be pus inside, and cystic, in which case like a sac deep down, and that could be painful. Could be papular if there's hair follicle that has been destroyed, and could be a form of nodules. It could be mild when the closed skin follicles and comedones are limited to the face. It could be moderate when we have papules and pustules in large number on the face and trunk or the back. It will be severe when there's extensive painful bumps called nodules on the face and the back and everywhere. The risk factors here are hereditary in about 82% of affected people. Severe ones are associated with chromosomal XYY syndrome. Androgens during puberty facilitates hair growth and oily sebum production. That is why we ask for dihydroepiandrosterone and dihydrotestosterone, growth hormone, insulin-like growth factor 1, polycystic ovarian syndrome, and congenital adrenal hyperplasia. In all these situations, you are likely going to find acne. Testosterone replacement therapy will worsen acne, and anybody that is having a likelihood of having it will quickly come down with it if they are on that. Anabolic steroid, and of course, in the past, it used to be Propionibacterium acnes. Now the name of the bacteria has changed to Cutibacterium acnes. If they're present, then the acne will surface in the individual. Diet. Low glycemic diet is helpful. Researchers all over America, Australia, and some other parts of the world reveal that those on low glycemic diet will not cure the acne, but the rate at which it's going to be troublesome will reduce. And of course, I've mentioned stress. If you pass through emotional stress, your acne will surface the more and probably appear more troublesome. Environment with mechanical obstruction, like I said earlier, and medications like lithium, testosterone, high energy steroids, and antoine and iodides will all trigger acne. In conclusion, we will be talking about treatment as the next thing that should be of interest to you. If you want to know more about accurate, correct treatment of acne, please kindly click on this video. That I've come to the end of this presentation. Please click on this link. This will take you to the full treatment of acne. In fact, the correct treatment. What can we give you, and why are we giving you that medication or pieces of advice? All will be explained right here. Please remember to subscribe to my channel. I appreciate it.